when you treat kids who are actually don't have a severe problem, you're at much greater risk that the therapist will just introduce harms. And I saw it firsthand, certainly with the kids who convinced themselves that they were transgender. Very often with a therapist, the idea was reified. And we see that across the board, from everything from anxiety to depression, family alienation, the loss of a sense of agency. We're seeing in the rise of generation, they have an external locus of control in rates we've never seen before. They don't believe they can improve their own life, and they are highly treatment dependent. They think they have to call a therapist or an adult before they make any decision. These are young adults who feel that they can't make a decision in their lives. So we're seeing a lot of the harms that that therapy can cause. Those are the same ones that plague the rising generation.
Right. Okay. So you're pointing to a couple of factors that play a causal role, let's say, in the pathologization of therapy recipients. The first would be false diagnosis. So, for example, with the kids who have so-called gender dysphoria, I mean, you can look at this technically, and it's quite a straightforward thing to do. So basically, when anyone is in a position where they might be seeking or are likely to be offered psychotherapy, the fundamental reason for that is generally an excess of negative emotion and a dearth of positive emotion. So what you essentially see, it's very rare for people to be brought to the attention of the therapeutic enterprise voluntarily or involuntarily unless they're anxious and depressed. So the first thing you assume if you're a therapist, if you have any sense, is that the anxiety and depression is the cardinal reality. And then there's a subset. Then you can become more precise after that. You might say, well, for this adolescent or adult, their proclivity toward excess negative emotion takes the place of bodily concern, for example. And that's more common among women, generally speaking. It's more common among young women. In fact, it might be almost universally prevalent among young women, especially at that puberty cusp. And then you assume that the misattribution of the depression and anxiety to the bodily transformations is to be the target of the most specific interventions, right? You don't jump to the conclusion that if the person's depressed and anxious and they show signs of body dysmorphia, then they're born in the wrong body and they need surgical intervention. There's so many things wrong with that line of logic that it's almost a miracle that it could ever be established, right? And one of the errors that's most egregious in that regard is that you don't recommend the most damaging potential and irreversible treatment when you could start with something much simpler. Like I interviewed Chloe Cole, right? She's a famous detransitioner. She's having a rough time on every university campus she goes to, and she's suing the psychopathic butchers who destroyed her physiologically and damaged her future. And she told me, when I talked to her, that no therapist had ever even explained to her two simple facts. Number one, that when women hit puberty, when girls hit puberty, their levels of negative emotion reliably rise. And that because boys and girls have about the same level of negative emotion, but it switches at puberty. And then women have more negative emotion, comparatively speaking, on average, for the rest of their life. And there's lots of reasons for that, but the reasons in some ways are irrelevant. It's the fact that's relevant. It's like, well, you're 12, you're confused and anxious. Lots of people who are confused and anxious feel that they're the only people that feel that way, right? Especially when they're looking at everybody's Facebook page and their Instagram page, and all they see is this glamorous lie that people put forward in relationship to their own life. And then especially if they're isolated kids, they can't talk to anyone about it, and they feel they're the only people in the world who feel that way. So one of the things you do if you're a therapist that has even an iota of a clue is say, all these things that you think are characteristic of you are actually, they're normative. And so you can't be thinking that there's something specifically wrong with you, even though you're suffering. And then, so no one had ever explained that to her, and which is just appalling, right? Such a lapse of professional standard that it's jaw-dropping. And then they also didn't explain to her that here's one of the things that differentiates men from women is that when men experience negative emotion, they tend to focus on their comparative socioeconomic status. When women experience negative emotion, they tend to focus on bodily image. And the reason for that likely is that men are evaluated by women more harshly for their relative status, and women are evaluated more harshly by men for their physiological appearance, for the general appearance. And so there's a logic to it. But no one explained to her that it was highly likely in the case of an adolescent girl who was undergoing puberty and early. And she also said, she told me that she recognized quite early, maybe around 11, that when she went through puberty, she was going to have a relatively boyish figure. And she had kind of envisioned herself as Khloe Kardashian, right? This super curvy Marilyn Monroe excess, it's almost like a parody in some ways, but you can imagine that standing forward as a kind of ideal. She thought she was going to be boyish, and there was a part of her that thought, well, if I'm going to be boyish, maybe I could just be a boy, which is a really kind of quasi-delusional 11-year-old thought that should be dispensed with by anyone credible in about 15 seconds. But that was enough to start her searching down the wrong rabbit hole. And then, she got herself put in the hands of these absolutely criminally incompetent therapists. And they didn't even offer her the first 2 bits of information that anyone with any sense would have presented to her. Instead, they shunted her down the bloody hormonal transformation road, and that's almost a certain pathway to, longer term, trouble for sure, and even surgical intervention. And so, God, you just can't believe that such things are happening.